Hey guys, let's talk about this article that's behind me on the screen from United Healthcare. Now, this has been drumming up a lot of fear and anxiety and just anger within the profession. And I think it's misguided, at least misdirected. So before we get into the topic, let's talk about reacting versus responding, because I think the understanding of these two words is important. So typically when we talk about a reaction tends to be associated with a negative outcome. So for example, if I take a medication and I have a reaction, that's not usually a good thing, right? But if I take a medication and I respond, that's typically associated with a positive outcome. If something happens to me and I react versus respond, that is pretty obvious, like negative versus positive. So I think within the profession right now, many of those individuals are reacting negatively. They're looking at an article like this, and there's everything from people thinking that it's just, bad for patients, it's bad for the profession, that United Healthcare is devaluing the services that physical therapists provide. But I would rather that we look at what is actually being said here and we respond appropriately. So jumping into this, virtual physical therapy. And I think the main issue, hopefully, that most rational clinicians would take issue with is using the term physical therapy. But if we look into the article a little more clearly, and I really think it's just a misunderstanding, miscommunication. So they're talking here, virtual physical therapy for back pain is already covered by some United Healthcare plans, as is virtual care for dealing with shoulder and knee problems or other musculoskeletal issues. So the benefits of these virtual physical therapy sessions may include increased access to treatment, especially in rural areas, greater flexibility for scheduling, lower costs, less time away from work. And I genuinely believe when they say virtual physical therapy, they're talking about physical therapy treatments under the direct supervision of a licensed physical therapist. During virtual physical therapy, done via computer, smartphone, tablet, a therapist typically supports the patient through exercises and stretches designed to strengthen the core, support recovery from pain and injury, improve mobility, right? Okay, so they're clearly saying a therapist guided. An app, the app option for eligible members of certain United Healthcare plans. Another potential option is self-paced program called virtual physical therapy. Now, this is where they're using the term physical therapy again, but they're saying it guides members through PT exercises using and I don't know how you say that, Kaia Health app, which includes motion coaching, physical exercises, mind-body relaxation techniques, and educational videos. So when you go to this website, there's nothing here that they call physical therapy. They talk about, addressing pain throughout your body. They talk about their coaches. They talk about physical exercise, physical training. Your personalized program is based on your fitness and mobility. As you go stronger, program changes with you. Access to unlimited one-on-one support from certified health coaches. But they never use the term physical therapy. It's United Healthcare's author who uses the term virtual physical therapy right here. But then even within that, it says the app guides members through PT exercises. So I understand this article to be, you have a physical therapist who creates your program, and then you use the app essentially as your home exercise program. And it says how it works. The app uses front-facing smartphone camera and artificial intelligence technology to analyze a user's movements and while performing the PT exercises. So the app isn't prescribing the exercise. The app is analyzing a patient's movement through the exercise. The program gives real-time tips to carry out safe, effective exercise sessions between 10 to 25 minutes. If at any point certified health coach is needed, not a physical therapist, a certified health coach one can be accessed using the in-app chat. So not to belabor this, but the idea here is, and I think what we're missing is, this is really an opportunity for us to leverage existing technology within what it is that we can deliver. So I believe the greatest value of a physical therapist isn't in the actual delivery of the treatment. Anybody can deliver the treatment who's trained appropriately. I think the value in the physical therapist is the evaluation of the patient and the patient condition, understanding the context around what is causing the problem, what's going on, taking into account environmental factors, cognitive factors, past medical history, complexities, comorbidities, all of those things, and then creating the plan of care, establishing the goals with the patient. That is where the value of the therapist comes in. If we want to deliver the treatment that we prescribe, even better. But the reality is, for many patients, we're not necessary in the actual delivery of the patient care. Our primary role in the big scheme of things is all of the stuff that I've already mentioned. So I think that we could leverage this technology on a personal level. If they want to call this virtual physical therapy, I don't care. Obviously, there's individuals within the profession that want to keep physical therapy, those two words, a protected term. That's fine. I'll let them battle it out. I'm not going to waste my time on that. I'm going to focus on where I can deliver the greatest value to the greatest number of people. And that is taking a technology like this, implementing it, bringing it into the solution that I can deliver, and moving forward. So guys, let me know what you think. I look forward to hearing from you guys. I'll catch you on the next video.